So I look after hip and knee problems in all age groups, and this can range from adolescents and teenagers who have damaged ligaments in the hip or have developmental problems around the hip or knee, all the way up to older patients where their hip and knee joints are wearing out, and we're looking more towards a joint replacement type solution as opposed to joint preserving surgery for younger individuals. So really I think it's helpful to have an example from both my hip and knee practice of a typical patient. In the knee world, I would often see young active individuals who've damaged their knee during sport, often commonly tearing their anterior cruciate ligament, but I also in my practice will see people who've damaged posterior or lateral or medial ligaments in the knee, which are less commonly seen in mainstream orthopaedics. And these are individuals who are very keen to get back to their active lifestyles, and the instability and pain in their knees is really disabling and frustrating because they're used to being active, and sort of the forced inactivity of their knee injury can have quite a profound effect on their life. So we look at these patients and we talk about their aspirations and make a sound diagnosis of the damage to their knee. And I think it's important to be aware of the regularity of combined injuries in these patients. Quite commonly I'll see patients who've had surgery elsewhere where a single ligament has been reconstructed, but there have been other deficiencies in the knee which have not been diagnosed, and I think a really careful assessment of these patients is important. And obviously working as part of a sort of team of practitioners here at the Ridgeway Hospital is very helpful, backed up by a physiotherapy department I work with regularly and know well, and this is crucial in the rehabilitation of my patients following surgical reconstruction of their knees, and this can make an enormous difference to how quickly they can get back to sports, and also the quality of function in the knee when they return to sports. And in a similar age range I will see young adults who present with hip pain, and recently there's been emerging interest in the concept of variations in the shape of the hip which can give rise to a condition known as hip impingement. And these are people who present with activity related hip pain that previously were felt to be soft tissue injuries, and we're now recognising this is a variation in shape of the hip. And this is something that can be addressed with a combination of physiotherapy and surgery, and can lead to a real improvement in activity in these individuals. And we're starting to recognise that this is a condition that has led to young adults going on to develop arthritic hips in the long term, and so it's a fascinating area to treat, to see whether in future we may be able to change the outcome of these hips and improve the quality of their life, really. I think whenever you see a patient with hip or knee pain, you want to have a clear explanation of the options for treatment with the patient, because certain patients may choose to manage their condition without surgery, where others may wish to proceed directly to a surgical solution. And commonly in the knee we can see subtle maltracking of the patellofemoral joint, the kneecap thigh bone joint, and this can often cause quite disabling pain with activity, which can prevent people from playing their sports. But actually a real multidisciplinary assessment with physiotherapists and podiatrists can look at the way they run, jump and move, and focal strengthening of muscle groups around the knee can improve knee function without any surgical intervention. On occasions patients may merely need injections to reduce inflammation around the knee that allows them to participate in a rehabilitation program. And I think it's looking after these active individuals who enjoy their sports, it's important to work as part of a team, because often my surgical skills will not be required to get these patients back to their sports. So patients obviously present with their hip and knee pain after various periods of time, really. I think where people have had an acute injury, they will often present quite early, and I think that can be important because active physiotherapy to rehabilitate after the injury early can make a big difference to surgical results in terms of getting motion back in either the hip or knee after an injury, and also minimising any muscle weakness that can occur because of the injury. And that can be helpful when the patients go on to any surgery to reconstruct the damage from the injury, as they're starting from a better position rather than starting from a position of weakness and dysfunction. In older patients, often it's helpful to come and discuss hip and knee pain even when surgical intervention is not required. I think patients often want to know what the diagnosis is, but also know what the treatment options are. And although they may not feel at that point they're ready for a joint replacement, it's often helpful to have a discussion and be informed about their condition, and also some advice about what might make their quality of life better without surgery. And it's even simple things such as the use of painkillers before a round of golf can make a big difference to the quality of people's lives. So in younger patients undergoing ligament reconstruction around the knee, we certainly expect to have pain-free function and good stability in the majority of patients. Where there's been other damage to the knee, such as damage to the joint surfaces or the shock-absorbing meniscal tissue in the knee, then these patients may have persistent swelling and pain despite successful surgery. And I think this is an area where careful preoperative counselling of what expectation is reasonable after surgery is crucial for patients. In older patients after joint replacement, we expect to make a very significant impact on the reduction of their pain and improvement in their function. There's some variation in results across the literature between hip and knee replacements, and certainly the knee replacements will tend to present more commonly with a degree of dissatisfaction. And I think having an open discussion that up to 10 or 20% of patients may have something about their knee replacement that isn't as good as they'd hoped for prior to surgery is very important. And I think where people have a clear understanding of what's reasonable to expect from their treatment, they're much more likely to be satisfied with the outcome.